The blood hit the floor before anyone screamed. It spread fast, dark and thick, pooling between the cracks in the linoleum like it had somewhere to be. A man was down near the triage bay, a second one crumpled against the nurse's station, and somewhere in the corridor beyond the double doors, a third was making a sound that didn't belong in any hospital. Staff were pressed behind overturned carts. A doctor was on his knees with his hands laced behind his head. Every trained professional in that emergency room had frozen solid. Nobody was looking at the quiet woman near the supply corridor. They never looked at her. That was the last mistake those men ever made. Before you find out what happened next, if this story already has you gripping your seat, hit that follow button, leave a like, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. Now let's get into it. The shift started the way every shift started for Nora Voss at Hargrove Memorial Hospital in Clover Falls, Nevada. Someone else's mess, someone else's attitude, and the particular brand of silence that follows a person who has been dismissed so many times, she stopped expecting anything different. Voss, the charge nurse, a stout woman named Phyllis Drummond, didn't bother looking up from the scheduling board. Trauma Bay 3 needs a full restock. After that, Mr. Aldridge in room 9 is asking for his third pain assessment in 2 hours, and I need you to document all 3 and explain why none of them were escalated properly. Nora picked up the supply list without comment. And the break room sink is backed up again, Drummond added. Maintenance isn't coming until Thursday. I'll look at it. Drummond finally glanced at her, a flat, dismissive look, the kind of person gives a piece of furniture. I don't need you to look at it. I need it fixed, or I need you to stop telling me you'll handle things you can't handle. Nora said nothing. She walked toward Trauma Bay 3 with the supply list folded in her hand. She was 28 years old. She had been a nurse at Hargrove Memorial for 14 months. In that time, she had been written up twice for what her supervisors described as failure to communicate effectively with the medical team, had been passed over for a charge position that went to a woman with 8 fewer months of experience, and had been reassigned from the ICU, where she had specifically requested to work, to the emergency department, where the volume was highest and the tolerance for quiet competence was lowest. She was also, though nobody at Hargrove Memorial knew it, a former combat medic with the 7th Special Operations Support Command, with 5 years of field service across 3 rotations and a classified performance record that her current supervisor would not have been able to access even if she'd tried. Nora didn't talk about that. There was no particular reason to. The work was the work. She restocked the trauma bay methodically. Saline bags, IV lines, pressure dressings, tourniquet supplies, checked expiration dates on 2 items that should have been flagged by the last person to do inventory, and made a note on the supply sheet. She completed the pain documentation for Mr. Aldridge in room 9, who was 73 and post-surgical and genuinely uncomfortable and deserved better than being treated like a nuisance. She looked at the break room sink, identified the clog, and fixed it with a drain snake she found in the maintenance closet without telling anyone she'd done it. It was 6:47 p.m. when she got her first real break. She took it in the stairwell, not the break room, never the break room, sitting on the 3rd step from the bottom with a cup of coffee that had gone lukewarm. She didn't have her phone out. She just sat. The stairwell was the only place in Hargrove Memorial that reliably gave her 20 feet of empty space. The emergency department never fully quieted. There was always a monitor alarming, always a family member with a question, always someone calling her name in a tone that managed to communicate both urgency and contempt. Here, the only sound was the ventilation system and the occasional distant clang of a door somewhere above. She had learned to find quiet wherever she could. That skill, like several others she kept carefully unexpressed, dated back to places that had nothing to do with Nevada. She was still sitting there when the doors at the bottom of the stairwell opened and Dr. Preston Walsh walked in. Walsh was the attending physician who ran the evening shift in the ED, early 40s, square jaw, the kind of confident that has never once been seriously challenged. He was, by almost any measure of the word, excellent at his job. He was also the person who had written both of Nora's disciplinary notices, who had told the chief of staff during a department review that she was a functional nurse but not leadership material, and who addressed her in the same tone he used when dictating notes, clipped, impersonal, slightly impatient. He didn't see her at first. He was typing something on his phone, brow furrowed. Then he looked up. Voss. Dr. Walsh. He glanced at her coffee cup, then at his watch. Break started at 6:30. It's 6:52. I was fixing the sink in the break room. I didn't start the break until 6:40. A pause. He seemed to consider whether to push it, decided it wasn't worth it, and tucked his phone into his coat pocket. We've got a multi-car on Route 9, could be 4 incoming, could be 7. Drummond's reorganizing the bays. I need you on triage. I'll be right there. He was already pushing through the door back into the ED. It didn't close fully behind him. Through the gap, she heard the distinct sound of the department shifting, the particular quality of noise that meant something real was coming in. She stood, poured the rest of the coffee into the corner drain, and followed him. The multi-vehicle accident produced 6 patients over 40 minutes, ranging from a teenage girl with a fractured radius and a shallow laceration above her eye to a 41-year-old man in hemorrhagic shock who consumed the next hour and a half of her attention, and Walsh's and 2 other physicians without pause. Nora worked without talking unless spoken to. She anticipated needs, saw Walsh reaching for a line and had it ready before he asked, recognized the early signs of a pressure drop in patient 4, and flagged it to the resident before the monitor caught it, kept the bay organized during the kind of controlled chaos that tends to make controlled things fall apart. Nobody commented on any of it. At one point, a second-year resident named Dr. Okafor glanced over at her and said, "Can you?" and then stopped because she was already handing him what he needed. He looked slightly unsettled by that. He didn't say anything. After the hemorrhagic shock patient was stabilized and moved to surgical, Nora stripped her gloves and started cleaning the bay. Walsh was at the station, dictating. He glanced up once, seemed about to say something, and then went back to his dictation. The department had a brief lull around 9 p.m., the kind that doesn't trust itself. The staff knew from experience it wouldn't last, so nobody fully exhaled. Nora used it to check on 3 patients who had been sitting in the waiting area for longer than was reasonable given their presentations, updated their charts, and flagged one of them. A 55-year-old woman with what had been logged as anxiety symptoms, but whose blood pressure and heart rate pattern looked like something else, to the triage nurse, a man named Garrett Solis. Solis was 26, 2 years into his nursing career, and had the specific quality of confidence that comes from being liked rather than being skilled. He glanced at Nora's note, glanced at the patient through the glass, and shrugged. "She's already been triaged, Voss. Her presentation's changed in the last hour." "And you're what, her physician now?" Nora met his eyes. "I'm flagging it. That's what the protocol says to do. The protocol says to let the attending decide, which you're not." He turned back to his station. "I'll mention it when Walsh has a minute." She held still for exactly 2 seconds. Then she went directly to Walsh. Walsh, to his credit, acted on it immediately. Pulled the woman back, ordered an EKG, and had her in a monitored bay within 8 minutes. The EKG showed a classic STEMI pattern. A cardiology consult was called. The woman was in the cath lab 40 minutes later. Walsh didn't thank Nora. He didn't acknowledge the catch at all, not in front of anyone. What he did do was look at her for a moment with an expression she couldn't quite classify, not quite respect, not quite discomfort, and then turn away. Solis didn't speak to her for the rest of the shift. She didn't expect him to. It was near the end of the shift, around 11:15, when the night cracked open. The first sign was a man walking into the ED through the ambulance bay entrance rather than the main doors. That alone wasn't unusual. What was unusual was that he was holding his left arm at an angle that suggested a wound rather than an injury, the tight, controlled way someone holds a part of themselves they don't want examined. He was dressed in civilian clothes, but there was something in his posture, in the way his eyes went immediately to the room's corners and exits, rather than to the reception desk, that took a specific kind of experience to recognize. Nora recognized it. She was at the supply corridor entrance, 12 feet away, and she stopped moving. The man reached the desk. Solis leaned forward. There was a brief exchange. The man said something. Solis said something back, and then the man's hand moved below the desk line, and the sound that followed was not loud, but it was absolutely clarifying. The metal-on-laminate sound of a weapon being set down with purpose. not drawn, set down, which meant it was a message, not an action. Not yet. Nora's hand was already at the supply closet door handle. More came through the ambulance bay. 4 of them, moving with the same studied casualness that didn't fool her for half a second. One moved toward the waiting area. One moved toward the corridor that led to the inpatient bays. One went to the secondary nurses' station. The 4th stood at the ambulance bay doors with his back to the room, watching the parking lot. The ED had approximately 19 staff members on the floor, 32 patients in various stages of care, and 11 family members in the waiting area. Walsh, at the central station, had gone completely still. Drummond had backed herself against the medication cart and was breathing through her nose in short, rapid pulls. The man at the desk, the one with the wound, spoke again, louder now. His voice carried clearly across the suddenly silent department. "Nobody needs to get hurt. We need the patient in Bay 7. Give us 2 minutes with him and we walk." Bay 7 was a 29-year-old male who had come in 3 hours ago with 2 gunshot wounds to the torso, who had been stabilized by Walsh and a trauma surgeon named Dr. Adele Frost, and who had 2 uniformed police officers stationed outside his bay on direct orders from the Clover Falls PD. The man in Bay 7, according to what had filtered through the department in the way things always filter through emergency departments regardless of official information controls, was connected to a trafficking network operating out of the eastern part of the state. The 2 police officers outside Bay 7 were, at that moment, being managed by 2 of the gunmen who had come in through the back. Nora was inside the supply closet. The door was closed. The light was off. She stood completely still in the dark, listening. The sounds of the department reorganized themselves in her mind the way terrain does when you've been trained to read it as a tactical problem. Not floors and corridors, but angles and distances and bottlenecks. The 4 visible gunmen, the 2 at the back managing the officers. Possibly more outside? 6 minimum, probably more. Her hands weren't shaking. That was the thing nobody would have predicted. Her hands were absolutely steady, but her chest was a different matter. The supply closet smelled like antiseptic and clean linen, and the inside of a specific type of darkness that she associated with places that were not hospitals, bunkers, corridors, the back of transport vehicles, and environments where the air itself felt hostile. Her heart rate was elevated. Her breathing was controlled because she had forced it to be. She had not been in a situation like this in nearly 4 years. She had worked very hard to make sure she never would be again. From outside the closet, she heard Drummond say in a voice stripped of everything except fear, "You need to understand, there are patients in critical condition in this building. Bay 7, the lead gunman repeated. That's all we're asking for. That patient is post-surgical. Moving him could—" "Lady, I'm not asking." Drummond went quiet. A beat. Then Walsh's voice, and the thing about Walsh, the thing Nora had noticed in 14 months of working beside him, was that the man did not scare easily. He was good under pressure in the clinical sense. This was not the clinical sense. "What you're describing," Walsh said carefully, "is removing a patient who is currently on 3 drips and a cardiac monitor. If he's moved without proper, then we'll move him improperly." Silence. Nora's hand found the edge of a shelf in the dark. Her fingers moved along it without sound. Gauze rolls, tape, saline flushes, scissors. Not the type of scissors that helped anyone. She moved her hand further. The trauma shears were on the second shelf, right side, where she'd put them herself during the restock 4 hours ago. She picked them up. They were 7 inches of hardened stainless steel with a serrated lower blade designed to cut through clothing, seat belts, and tactical gear. They were not a weapon, except that everything is a weapon, given the right training and the right desperation. She was not desperate. That was the other thing nobody would have predicted. She was not afraid in the way people expected fear to look. She was, and she recognized this with something like resignation, like a door opening in a house she thought she'd locked. Operational. The switch had flipped. She hadn't thrown it, but it was thrown. She pressed her ear to the door. 2 voices near the triage desk, roughly 20 feet to her left. 1 voice near the corridor entrance. That would be the one guarding the back route to the monitored bays. The one at the ambulance doors was 4, maybe 5 seconds from her position if she moved quickly. She calculated this without emotion. Not because she didn't feel anything, but because the part of her that ran calculations did not traffic in emotion. It never had. She had the position of 3 of the 4 visible gunmen mapped. She put her hand on the closet door handle and thought about whether she was doing this. She thought about it for approximately 1 second. Then she heard a sound from the corridor, a short, cut-off cry, female. And that was the end of the thinking. She opened the door. The supply corridor opened onto the left flank of the main ED floor at a 90-degree angle to the nurse's station. The ambient light was low. The department had been forced onto reduced lighting at some point, probably by one of the gunmen trying to increase their visual control of the space. It worked against them the moment she stepped out. She was 15 feet behind the gunmen at the corridor and entrance before he heard anything. She knew she had perhaps 3 seconds before one of the others spotted the movement. She moved in a straight line, low and fast, and the thing about trauma shears that makes them effective for what she used them for is the weight of the handle and the fact that 7 inches of steel traveling at speed, driven by the base of a trained hand rather than the edge, lands with a specific kind of force against the base of a human skull that is reliably conclusive. The man went down without making a sound that carried. She caught him, lowered him, had his weapon, a semi-automatic pistol, suppressor equipped, 1 round already chambered, in her hand in under 4 seconds. She pressed herself flat against the corridor wall. Across the main floor she could see Walsh. He was looking in her direction. His face had gone from controlled fear to something she didn't have time to interpret. She looked away from him. 3 visible gunmen remaining on the floor, 2 more at the back with the officers, possibly others she hadn't placed. She moved deeper into the corridor. The sound she'd heard, the cut-off cry, had come from exam room 2, which was the 3rd door on the right. She reached it in 8 seconds, stayed flat to the wall beside the door frame, and listened for 2 full seconds before she moved. What she heard was one voice, male, mid-range, irritated, and underneath it, the sound of someone else in the room trying very hard not to make noise. She went through the door low and fast, and the gunman inside did not have time to process what he was seeing before she put him down. The person in the room was Lena Marsh, a 24-year-old nursing assistant who had been hired 6 weeks ago and who had spent most of those 6 weeks being told by Solis and 2 of the senior nurses that she was too slow and too soft for emergency medicine. She was pressed into the corner beside the exam table with her knees pulled up and her hands over her mouth. She stared at Nora. Nora looked back at her. "Don't move. Don't make noise. Get under the exam table and stay there until you hear all clear." Lena stared. "Lena." Nora kept her voice flat and low. "Under the table. Now." Lena moved. She was shaking so badly her knees knocked against the table leg, but she moved. Nora pulled the door closed behind her and turned back to the corridor. 4 down. At least 4 remaining. The ED was quiet in the way that means everyone is holding their breath. She checked the suppressor on the weapon in her hand, confirmed the safety position, and moved toward the T-junction at the corridor's midpoint. Behind her, somewhere in the main bay, she heard the lead gunman's voice again. Different now, faster, scanning, saying something to one of the others that she couldn't quite make out. They'd noticed something was wrong. She increased her pace. The T-junction led right toward the monitored bays and left toward the trauma corridor. Bay 7 was to the right, 60 feet, 2 doors, and whatever was left of the 2 officers who had been stationed there. She turned left. Not toward the patient, toward the position she needed. She had been in this building for 14 months. She knew where the secondary security station was, where the emergency intercom panel was, where the backup communications terminal was that most of the staff didn't know existed because it was behind a panel in the trauma corridor that looked like a maintenance access point. She found it in the dark without hesitating. She pulled the panel open, found the handset, and pressed the emergency transmit key. The tone that confirmed connection was barely audible. She spoke in the clear, flat cadence of someone who has called in situations like this before, though she had worked very hard to believe she never would again. Hargrove Memorial Emergency. Active hostage situation. Multiple armed subjects. Gunshot casualty potential. Requesting immediate law enforcement response and tactical support.